If radiology had a crystal ball, it would be the McCormick Center after Thanksgiving. Hundreds of companies, big and small, converge as part of the annual meeting of the Radiological Society of North America. Many technologies are being shown for the first time. Some will be released in the coming few months. Others are still experimental, works in progress. I'm Greg Freiherr. This is my 32nd RSNA. If you were at RSNA 2015, I'll give you the context for what you saw. If you weren't here, I'll show you what you missed. Radiology was the first medical discipline to adopt information technology. Digital images made by MR and CT made it logical to do so. Yet in the beginning, soft copy reading, as it was called back then, was hotly debated. Today, the thousands of images produced by CT in a single scan, the reformatted MRs, the digital ultrasound, angio, cardiac cath, mammograms, and radiographs have made PACS a foregone conclusion. But value-based medicine is shaking things up. Images need to be transferred not only within radiology, but across the enterprise. They must be viewed in the context of other data, which is rapidly expanding from many diverse sources. This is the new era of enterprise imaging. Productivity in a world moving toward value-based medicine depends on making images available across departments and devices. At RSNA 2015, Siemens is demonstrating how Single Plaza can support this exchange of data, accelerate interpretation, and streamline workflow.
With Single Plaza, we're focusing on routine 2D reading and 3D reading, including MIPS, MPRs, VRTs. So Single Plaza is really the front end for our customers, the radiologists, to conduct a reading report. With Single Share, we are having an archive that is underneath the front end, underneath the Single Plaza viewing tools. And with Single Share, we are indeed having a vendor-neutral archive. It acts as a multimedia archive, covering a variety of document types, up to 300 different document types, to enable not only the repository or the storing of images and data, but also the exchange and the sharing of data within an enterprise or even going beyond that.
TeamPlay is separate from Single Plaza. It is a cloud-based network that promotes collaboration, bringing healthcare professionals and patients together, along with clinical data in a way that makes decision-making faster.
In order to go global, we are currently forming a network of clinicians and radiologists, which we call TeamPlay. We're bringing together their global expertise, their knowledge, in order to help the radiologists, our customers, to face and to solve local challenges that they're seeing day by day. May that be, for instance, optimizing the dose exposures for their patients, or may it be optimizing the clinical and operational workflows in their environment by looking into better utilization of the imaging equipment. And in addition to that, this year we're also introducing a protocol management which allows them to better clinically operate, but also being more efficient in their day-to-day work.
GE unveiled at this RSNA a cloud-based platform to connect radiologists and clinicians with unprecedented speed and efficiency. This GE Health Cloud will shift image post-processing from on-site machines to the cloud, then make the processed images available to multiple users across the enterprise.
Centricity Solutions for Enterprise Imaging is our broad enterprise imaging suite that offers solutions for customers to manage their image archiving, their collaboration, their visualization, and their workflow. As part of this, we're going to be moving the Centricity Enterprise applications into the GE Health Cloud over a period of years. We're launching our first set of applications at RSNA this year: Centricity Cloud Advanced Visualization, Centricity MDT Virtual Team Meeting, and Centricity Case Exchange. These apps are part of Centricity Solutions for Enterprise Imaging, and they'll be moving more apps from the imaging portfolio into the GE Health Cloud over the next coming years. The GE Health Cloud is a platform for running healthcare applications as a service in the cloud. And that's a secure, connected platform. And then there's going to be an app store on top of it. The platform itself is HIPAA compliant, SOC 2 certified, high tech, all the key security pieces that you want to run a healthcare application in the cloud. But like any good platform, it's useless without the applications. So we've put together an app store, just like Apple or just like Android from Google. And in that app store, GE hopes to put our applications, and they'll only hope to be 20% of those applications will come from GE Healthcare. We want the other 80% of applications in the App Store to come from independent software vendors. Whether it's two guys in a garage writing their first piece of code, or whether you're a major academic medical center and an industry-leading scientist developing algorithms, we want all those healthcare applications to be running in the GE Health Cloud. And so we've put together a software development toolkit as well as a complete subscription and billing management infrastructure to help these software companies run their apps in the GE Health Cloud. We want to be the one-stop shop for healthcare software in the cloud.
Radiologists have long been in the role of the doctor's doctor, interpreting images and providing the results to clinicians. Now they are hoping to expand their influence, consult with referring physicians as members of an integrated patient management team. Cerner argues that PACS and risk-driven information models are relics of the way radiology used to be, and that it has to change if radiology is going to be an integral part of the future.
Let's first understand what EMR-driven means. The electronic medical record is the workflow engine for the care team and for the physicians. And really the radiologist is one of the last to be into the EMR and doing their care. So the EMR takes inputs, it also provides information and contextual information. So when we get the radiologist into the EMR-driven workflow, we give them contextual information about the care process. We give them contextual information about the patient. And we give them contextual information of what they need to help us understand so downstream care teams can take action upon that information. And hence, the EMR-driven workflow, in our opinion, is the best workflow. It's not risk-driven, it's not PACS-driven. The EMR has the contextual information.
Today I'm going to be demonstrating the workflow that a radiologist utilizes to actually help diagnose, access the patient's EMR, and then be a part of that actual care team. I can review prior documentation that the patient has had done, as well as prior diagnostic procedures. At this point, I can utilize decision support to help guide me to the appropriate order for the patient. Having it display to the ordering physician right upon order entry, I'm able to select the most appropriate exam based upon what was told about that patient. So giving it a little bit more information, selecting the most appropriate over here on the right-hand side. This information is then carried over with the additional fields you see here into the EMR. That translates over to what the radiologist sees in their workflow. This is the radiology desktop, so it's essentially the cockpit for everything that the radiologist needs to do. I have prior order information displayed in the center, as well as any notes that have been entered over here on the left-hand side. My images are displayed right within my PACS. My viewer has both prior images as well as other modalities. From here, I have full access to the EMR, so not only do I have the ability to review everything about that patient that was done in the imaging department, but I can actually launch into the patient's EMR. And I can administer a note or some kind of comment right back to that ordering physician, indicating that the appropriate order has been placed, and thereby communicating positive protocol and also positive consultation, and that I agree with that physician's order.
Sectra's Enterprise Image Management System enables different members of the patient care team by providing them the medical images when they need them. At this RSNA, the company is showing how in oncology, for example, different members of the medical team use EIM to retrieve and process images that help them put together and implement a patient management plan.
So at Sectra, we're deeply committed to making sure that our customers are able to really support their patients across their whole care pathway. We do this by providing consolidated patient record, supporting everything from radiology, pathology, ultrasound images, as well as histopathology. By doing so, we also support the complex care pathways across oncology, where we're able to also support tumor boards in a very, very efficient manner. What I'm doing now with just one click is actually pulling up all the different images that we've gathered around this care pathway at this point in time. It includes everything from ultrasound images to mammograms to actual microscopic images of the biopsy, as well as specimen x-rays. What really makes Sectra's solution unique is that we also bring histopathology images together with radiology, allowing our customers and our users to really make that step forward, increasing efficiency and in quality actually in the decision-making process of healthcare. From a cancer care pathway, this is really unique, and it's really providing a rich, powerful tool set to improve healthcare for our users and ultimately all the patients.
The new era of enterprise imaging goes beyond the traditional bounds of radiology. It includes data coming from or going to different medical disciplines and different devices, including wearables and mobile phones. These diverse clinical data need to be managed and distributed in a meaningful way. Carestream Health integrates them using its View reporting module.
The diagnostic report is one of the most critical output of radiology department, not only because it's the way to communicate the insight for the radiologist to the rest of the referring physicians, but it's also critical for treatment planning, the next step in the patient care, and ultimately a better collaborative care. When you look at View reporting, there are a couple of things you'll see immediately that's very different. One, you'll notice the hyperlinks that will take you directly to the anatomical bookmarks. You'll also see a couple of key insights from the radiologist shareable now with specialists such as oncology, surgery, for further treatment planning. When I want to look at a specific insight, the hyperlink now will take me directly to the anatomical bookmark along with that report. So now not only I can see whatever the diagnostic has been made, the key image, I could also now look at comparing other historicals immediately within a click. This has been proven to help referring physicians access the critical insight they're looking for, the time when they want it, whether it's at bedside, part of the surgery planning, or even on their mobile phones. Well, the other important element of collaboration is, of course, the ability for referring physicians to access all of the holistic patient information from a single viewer. Here we have what we call an enterprise viewer, where the physician has the ability not only to access all the historicals, but also view them as well, whether it's radiology, dermatology, cardiology information, it's all a single click away.
This technology report on enterprise imaging is sponsored by McKesson. Establishing a synergy between people and technology is critical when moving toward an enterprise-wide involvement of medical disciplines, according to executives at McKesson Health IT. Stakeholders in the management of a patient must be identified along with the technology that can be used to meet their needs. At this RSNA, McKesson says its technology and the expertise of its staff have come together to provide a single view of patient imaging data across the enterprise.
One of the things I think people need to recognize is McKesson's a very large organization, and we have a tremendous bench of domain expertise that we introduce to executive level people within diagnostic imaging environments, where we can bring that domain expertise to expand some of their workflow intelligence, some of the VNAs, some of the interoperability challenges that most organizations face today. And so we bring these domain expertise to solve some of these complex problems within our customers.
What I'm showing you today is our consolidated task list that combines multiple packs but also multiple tasks. So if you notice, I can click through, I can go through my interpretation, my quality, my communication tasks. I can look at my rotation for today, and it puts it all into a consolidated list, all prioritized according to my business needs. We can get really granular, identify your stroke cases, your level 1 trauma cases, your PE screenings, and pull them out from your other cases to make sure that they're identified easily in the work list. We're also launching multiple packs, which brings together silos of information. So you can imagine all your IDNs have separate silos and packs information that exist, and we want to bring those together into the enterprise work list. So we're consolidating tasks and packs, which allows you to utilize resources across the enterprise, make use of communication tools like pop-ups and emails, make sure that you're really communicating everything that you want to go on across your enterprise with business and workflow rules that are driving efficiency and value.
We realize a lot of department level imaging directors, C-suite level directors looking at enterprise visions today are really challenged by some of these complex challenges within their organization. And so we really bring that type of domain expertise to align the business objectives to really build a strategic plan that's really important to the overall adoption of any technology within the ecosystem of diagnostic imaging. We believe in more than just technology. It's really about the transformation, the adoption, the utilization of that technology to realize the actual benefit of that capital expenditure organizations are really putting into technology today.
AGFA Healthcare's enterprise imaging platform, which the company is featuring at this RSNA, consolidates images across the healthcare enterprise. It is driven by task-based workflow and powered by a rules-based engine. Together, they achieve the business and clinical goals of reduced cost and increased efficiency in managing patients.
We've really strived to bring the whole healthcare enterprise together, both from a technology standpoint and from a clinical standpoint. The platform consolidation enables us to take technologies and spread them across the enterprise from an acquisition, distribution, diagnosis, and consumption of images throughout the healthcare enterprise. We've taken advantage of some of the latest technological advancements in software to do things in a unique way that no other vendor can do. We're able to drive workflow and productivity through a rules engine and task-based workflow that can distribute workflow, distribute notifications, handle things like critical results. We can really attack problems that are key issues for customers with a single consolidated solution. So one of the technological advancements that we've taken care of in software is the notion of a rules engine. So what this does is it allows us to define a set of logic gates through the system that can be stitched together to create different workflows within the system. Very dynamic. So what we've done is decompose these down to the very basic concepts of rules that would occur in a system. You have a certain amount of time that something goes by, you have a certain location, certain user groups, certain type of image that's captured, certain type of information that comes into the system. All of these can be triggering events to cause a task to be assigned to somebody.
Speed is a key ingredient of an information system. This is especially so when it comes to medical information. Fujifilm has made a virtue of speed in the transmission of images and medical data across the enterprise using its Synapse 5 image visualization technology, which provides sub-second response time.
Speed is the -- 1 important factor in any image visualization technology. Radiologists, they want to see speed and performance when they're reading. That's important to the turnaround times. The challenge today is data sets are getting larger and larger, and that is a challenge for the network utilization as well, and the desktops are unable to handle these large data sets. And so we wanted to introduce a technology that addresses that challenge. Because we have a zero footprint and nothing is actually running other than the browser, we can run on a Mac, we can run on Chrome, we can run on IE. I'm going to show some of the largest data sets that we could find, and I'm going to open them and show you that performance. So the first I'll show is a 20,000 image study. So I'm getting an indication that someone else is looking at that study. I open it. Now what you've seen is you saw that study open and appear. I see a patient jacket. I have all 20,000 images in view, and I can immediately scroll through those images. Nothing has been cached on this workstation. Everything is streaming from the server. There's no delay, and there's no complexity at the desktop. So by not having a client, upgrades become easier. There's no IT complexity of managing all the desktops. But I get the performance, and at the same time, I'm utilizing half of the network capacity that was required for legacy PACS systems.
Increasingly, physicians are facing data overload. At this RSNA, Philips Healthcare is featuring tools that will help physicians make sense of this flood of data. running on the company's IntelliSpace for radiology and the enterprise. The company's measurement assistant and oncology dashboard are being featured as the means for performing analytics that will streamline workflow.
Radiologists today are overwhelmed with a lot of data, and they're trying to obviously be more integrated into the care delivery with the referrers. So the challenge today is that there's been a lot of optimization around data management, but not really a lot has gone into the interplay between the data management, the analytics, and the actionable insights that actually then take it all the way through to how you would change the paradigm for clinical interpretation and how you would curate information in a way that is more consumable for the referrer. So we have a solution today that demonstrates how Philips is reinventing radiology around those areas, and it's a couple between the measurement assistant and the oncology dashboard. The measurement assistant is really a tool that aids the radiologist in being more efficient and reducing error, and they do it in a way where we're actually taking an inventory of all the measurements for patients who have regular follow-up. And that information then is curated in a very consumable way for the oncologist in the form of an oncology dashboard. That then is the beginning of a collaborative result sharing between the radiologist and the oncologist, where the oncologist is able to complement the results with additional relevant information around the treatment of that patient. So the measurement assistant is actually where the radiologist would start their workflow, and it's a good example how it demonstrates the interplay between the data, the actionable insights, the actionable workflow, and how then you create information that's relevant for the oncologist. So what the radiologist would be doing is they'd be taking inventory of the measurements, the appropriate measurements for the patient, and often for a chronic patient there's a myriad of those, and it's quite difficult to find the appropriate image slice so that you can take that measurement. So what this actually does is it drives your workflow. So this is the oncology dashboard really showing a trend over a period of time. It's the longitudinal view of that lesion. And then what the oncologist is able to do is easily access the appropriate images where those measurements were taken, and thereafter also complement that information with treatment information, such as when medication was started or stopped, or when treatment, perhaps such as chemotherapy, was started or stopped. So this is really a good example of how through data management, actionable insights, actionable workflow, and then relevant curation and result sharing, you're able to demonstrate a pathway through the interplay of each of those components.
We are going where only those who have invitations are allowed, an area along the side of the South Hall at the RSNA, where companies demonstrate their most advanced technologies. We have been invited by Enlytic to see its deep learning algorithm, which has been developed to analyze medical images. Unlike computer-aided algorithms now widely used in mammography, Enlytic's algorithm has been designed to learn as it goes, getting better with experience. As we are here at the RSNA, it is underway, beginning to learn on the job at dozens of imaging clinics outside the United States.
The way the technology works is it reads an entire archive of medical data, including x-rays and other types of medical images, CT scans, MRIs, lab reports, patient data, pathology, radiologist reports. And it leverages that whole archive to find patterns. It's actually learning just the same way that a medical student learns. So a medical student needs examples to learn. They need lots of examples. They need a lot of examples of what looks normal and all the varieties of human anatomy and modalities. They also need many examples of each type of abnormality and how they're presented. From lung CTs, we can learn something about human anatomy, human tissue, and some of that will actually transfer to other body parts, other modalities, which is very exciting. That's the promise of deep learning. Here I'm showing an example here where this patient has come in for a lung CT, and the first step is to search through the CT for candidate nodules. I'm showing a cross-sectional slice here, and the turquoise shows potential candidates, and it's, as you can see, it's converging on a candidate nodule. And now the next step is to see how malignant is this nodule. Not all nodules are malignant. So we've taken this patient and compared her to an entire archive of other lung CTs. The red ones here have already been established as cancerous. The blue ones are benign. So here you can see this nice clustering of discriminative features where this patient is clearly in this red cluster here, which unfortunately suggests that this nodule might be malignant. And we can zoom in to the nodule and see that the algorithm estimates that indeed this is a malignant nodule. And here are similar nodules, and that they're clinically similar nodules.
In value medicine, images will be the universal language. They will flow through the enterprise, bringing physicians together to diagnose, plan therapy, and follow up patients.